Hi everybody, my name is Loriann O'Brien. I am the nurse manager on the spinal cord injury unit on 1 North at Burke Rehabilitation Hospital. Today we're discussing self-catheterization of the female patient. To begin, I'd like to speak a little bit about using clean technique. During a catheterization process, both male and female, you're going to start by cleansing your hands, washing your hands with soap and water, by wetting your hands thoroughly, applying soap, rubbing the hands together thoroughly for at least 20 seconds, and then rinsing them thoroughly. You're then going to dry them with a disposable towel. Using that same towel, you're going to shut the faucet off. In other words, you're not going to touch the faucet. You don't want your hands to get dirty. If you're using an alcohol-based sanitizer, you're going to slather it all over your hands and cover your hands completely and rub your hands thoroughly together until completely dry. To speak a little bit about catheterization, when you're in the hospital, you'll notice that the nurses come to the bedside and they usually bring the catheter. They're donned in gloves and their gown. When you're catheterizing from home, you're going to be using clean technique. The reason for this is hospitals are overseen by a governing body called the Joint Commission, and the Joint Commission differentiates clean and aseptic technique as follows. Clean technique strives to reduce the number of microorganisms, to minimize the risk of transmission from the environment to the individual by using appropriate hand hygiene, such as cleansing your hands thoroughly or using clean gloves. Whereas aseptic technique, which is what is used in the hospital, requires the use of various barriers to prevent the transfer of microorganisms from the healthcare environment or personnel to the patient during the procedure. And in doing so, they use sterile gloves, gowns, drapes, and/or masks. Now I'm going to discuss step-by-step the catheterization process for a female patient. To begin, you're going to wash the genital region with soap and water or use an antiseptic towelette. Okay, here I have an antiseptic towelette to use. Like so. You're going to take your non-dominant hand to spread the labia and cleanse down each side of the labia using different parts of the towelette. Down the center. And discard the towelette. You're going to take your catheter, and this is a Vapro pocket catheter. We don't use these in the hospital. This is an example of the Vapro Plus catheter. This is the catheter you may have noticed that we use at the hospital. This is an example of the Infinochic catheter. These are available online, made by Hollister. It is a very small, pre-lubricated catheter that's great on the go. So, this first thing you're going to do is you're going to open the catheter, like so. You're going to remove the catheter from its packaging. I'm going to open the bag. Okay, this is my dominant hand. I'm going to remove the cap of the catheter with my non-dominant hand, making sure to keep the tip clean. Using my non-dominant hand, I'm going to spread the labia. I'm going to insert the catheter tip. I'm going to advance the catheter into the bladder until the urine begins to flow. Once the urine begins to flow, we let it fill the bag. Once it ceases, we gently remove the catheter. Discard it. It's not recommended that you reuse catheters. Most people self-catheterize every 4 to 6 hours or as stipulated by their physician. And we're going to wash the labia and wash our hands. And the catheterization process is complete, and that is the entire process.